our maternal health workforce to include more doulas and midwives. And for so many women, let's note, doulas are literally a lifeline. And so we must support all these healthcare professionals. And finally, with Congresswoman Yvette Clarke, I introduced the Uterine Fibroid Research and Education Act, legislation that would address many of the biggest issues that affect so many women, the underlying conditions that contribute to maternal mortality, uterine fibroids. And this is especially of concern for Black women who are more likely to be hospitalized as a result of that condition. So each of these bills forms the basis for the historic investment in our maternal health care included in our Build Back Better Act. Our Build Back Better Act will grow and diversify the perinatal nursing and doula workforce, support the work of the National Center on Birth Defects and Developmental Disabilities. It will promote health equity by taking action from increasing funding for maternal mental health to investing in maternal health research at minority-serving institutions. So here's but an example of what our Build Back Better Act will do. So currently in most state Medicaid programs, they only provide for 60 days of postpartum coverage for women. Our law will require state Medicaid and CHIP programs to provide a full year of coverage after a woman has given birth. Now, what does this mean? It means a full year of coverage for pelvic exams and vaccinations, for postpartum depression, screening, and regular checkups. According to a new report from the Department of Health and Human Services, this would cover 720,000 more people every year. HHS has also put out new guidance today to help states implement the extension. This action will save lives, and it will change lives. Our Build Back Better Act represents the single largest investment to address maternal mortality and morbidity in our nation ever. The House passed this bill just before Thanksgiving, and the President and I are confident that the Senate will do the same. So as I said from the start, in the United States of America, we must do everything we can to protect and to strengthen both maternal health and reproductive health. This is about the rights of women. This is about the future of our nation. And this will take all of us. And the actions we announce today are just the beginning. In April, here at the White House, I invited women who have experienced personally and deeply the tragedy of maternal mortality. Their stories were different, but they described a common feeling, a terrible feeling, the feeling of not being heard. On this day of action, may the women of our nation know, I hear you, we hear you, and we are here to take action. Thank you again. May God bless you, and may God bless America. Thank you.
Please welcome the Secretary of Health and Human Services, Javier Becerra.